Hello, welcome to my daughter Victoria's bedroom. For your purposes, this is going to be the site of our clinical lab while we are out of school. So let me introduce you to the patients within the clinical lab. We have the Cat in the Hat and Mr. Giraffe, and these two patients will be serving in other capacities for skills like range of motion exercise and turn in position because they're a little bit more soft and flexible. For today, we're going to be using Baby Lucy. Baby Lucy will be our patient for the skill of partial bed bath, which we're doing today. Let's go over and meet her. Okay, here's Baby Lucy. She is completely set up in her bed. She has a visitor, Mr. Lamb, and she's holding her call bell. She's wearing her hospital gown. We're going to serve as this table as the overbed table. Obviously, this is her bedside stand, and her belongings are on the bedside stand. So this is going to simulate our patient unit. This will be simulating my supply closet, and I won't be doing real water so that I don't have to stop the tape and go get water, so we're going to simulate the water. For hand washing, I'm going to be using the Purell, and the bowl will act as our basin. I have my soap, lotion, I have washcloths, towels. We're going to use one of the towels as a bath blanket because she's kind of small, and I have my gloves. Okay, we're ready to go. So the tester is going to say to you to provide a partial bed bath to your resident who remains in bed. The partial bed bath includes washing the face, neck, chest, one arm and hand. It involves washing the back and giving a back rub, changing the resident's gown, and then the resident remains in bed. So one infection control aspect that you want to be very careful about is to wash the eyes carefully, and we talked about this in the classroom. And again, this is meant to be a review, to prompt some questions, to ease your nerves, and to just kind of give you the step-by-step as a refresher while you're at home, and we can answer questions when we do the virtual classroom. Okay, so here we go. Tester reads, provide a partial bed bath to your resident who remains in bed. Wash the face, neck, chest, one arm and hand. Wash the back, give a back rub, change the gown, and your resident will remain in bed. Do you have any questions? I don't have any questions, so I'm going to begin my skill. I'm going to begin my skill with washing my hands. So I'm going to go over and do that. Okay, and because I'm using Purell, I'm going to be rubbing it on my hands until it is dry. All aspects, including my wrists, like I would simulate at the sink. So once my hands are washed, I'm going to knock on the door, enter the room, and introduce myself to the patient. Remember the three aspects to address, introduce, and identify. Here we go. Knock, knock, knock. Miss Lucy says to come in. Good morning, Miss Lucy. My name is Linda, and I'm going to assist you with a bath while you remain in bed. I'm checking her ID. I see you already have your call bell. I'm going to lock the wheels of her bed to make sure she's safe, pull her privacy curtain, and tell my resident that I'm going to get my supplies. If she needs me, she has the call bell. I'll be right back. So I'm going to step out of the room over to the supplies, and I'm going to obtain all of my supplies. Okay, so the first thing that I'm going to place, I'm going to have a barrier and put my supplies on top of that. And go into the room. Miss Lucy, I'm back. And here we go. Remember that the barriers that you guys will be using is a Chuck's. So we're doing a lot of simulation. And I know that might be a little confusing. So hopefully when we talk in person on the live classroom, you can ask any questions. I'm placing my overbed table so that I can wash my resident and have my supplies right nearby. Okay, here we go. Setting everything up. Okay, I would also make sure that Miss Lucy has her call bell, and I'm going to tell her I'm going into the bathroom to obtain the water. So I would go obtain the water, I would check the water at the sink, and now I'm going to go back into the room and tell her, Miss Lucy, I'm checking the water. It seems comfortable to me, but I'd like you to check it to see if it's comfortable to you. I'm going to remove her call bell. She checks the water, she says it's okay, and I'm going to begin putting on my gloves. I will talk to Miss Lucy as I do my skill, just to ease her mind that everything is okay. So I'm going to take my bath blanket first and put it over my patient for privacy and warmth, and I'm going to remove the sheet without exposing my patient in any way. So the sheet gets pulled down and fan folded at the bottom of the bed. I'm going to remove the top portion of the gown, again trying to ensure privacy for my patient, Miss Lucy. There she is. And one other thing, I'm going to take my towel and I'm going to put it over my patient's chest to make sure that I'm not wetting her chest unnecessarily. I take my first washcloth, wring it out. I'm going to make my mitten. Okay, and remember, you don't use any soap on the eyes or the face. So the first thing I'm going to do the eyes. Miss Lucy, can you close your eye? She does. I'm going to wipe the inner to outer portion. I'm going to turn my washcloth for infection control purposes. I'm going to wash her other eye. Please close your eye. And I wipe from inner to outer. Okay, I'm done. I'm going to dry her eye. I'm going to wipe from inner to outer. Miss Lucy, please close your eye. Okay, and then I'm going to take a separate corner, inner to outer. Okay, so our eyes are done. I'm now going to wet the washcloth and I'm going to wash her face. Again, we do not use any soap on the face. Here we go. All right, just washing your face. I'm going to wash behind her ears, her neck. I'm going to turn my washcloth to a different portion, just because it's good practice to use different parts of your washcloth. Again, behind the ears and the neck. Okay, this goes into here because there's no soap on it, and I'm going to dry behind the ears, other side of the face. Okay, I'm ready to move down. So you can choose to either do the chest or the arm. What I'm going to do is I'm going to put the arm on top of the towel, and I'm going to do the chest first because I started at the neck. Now we're going to apply soap. So I'm going to use 2 washcloths at this time. So I'm going to take my first washcloth, wring it out, apply soap, and I'm going to do her neck. Okay, and her chest. Okay, if Miss Lucy has breasts, I would have lifted up the breasts and wash underneath. I'm noting for any redness, any irritation, and I would report that or ask first my patient about it. Miss Lucy, I notice you have a little bit of redness under your right breast. Does that bother you? She says no. I'm going to report it to the nurse anyway. I'm going to take my soapy washcloth and keep it on the outside of my basin because I don't want my water to become soapy because it'll make it difficult to rinse. So I'm going to rinse off that soap that I applied to her chest, again lifting up the breasts and making sure that I'm cleaning underneath, and I cleaned all the way up to her abdomen. The rinse rag can remain in the basin. I take my towel and I'm going to wipe Miss Lucy and lift up her breasts. Okay, and I'm going to move the towel. Cover her up so she's nice and warm. Next, I'm going to do the arm. Okay, and again, I'm going to take the first washcloth. I'm going to turn it, whoops, apply soap, and I'm going to do the arm. Getting carefully under the arm, checking for any signs of irritation. I'm going to wash her fingers in between the fingers and all surfaces of the arm and hand. Put my washcloth down. The arm and hand are on the towel, and now I'm going to rinse. Okay, and she is rinsed. I can put that one there, and I'm going to dry all areas that I washed. Okay, Miss Lucy, I'm now going to turn you. So what I'm going to do is, in our classroom, this is a lot easier than it is here because the bed is smaller. I'm going to go to the side of the bed and I'm going to turn. I'm going to get on the bed because it's a little difficult, a little puffy. So I'm going to turn Miss Lucy. Okay, the gown would go at the bottom of the bed. I'm going to lower her head down, make sure that she's on her side. Okay, that would be the position. She's set. You're all right, Miss Lucy? She says yes. Okay, come around. And we're almost done with our skill, as you notice. I'm going to place the towel down behind her back. All right, I'm exposing the entire back, not the rest of her body. I take my soapy washcloth, I put soap on it, I soap from top to bottom. Remember, you're not washing the buttock area. That's a different skill. I'm going to wet the washcloth, rinse. Okay, and now I'm going to dry. All right, keep the towel down there. Miss Lucy, I'm going to provide you with a back rub. Warm up the lotion. Remember, I start from the bottom and go up 3 times. 1, 2, and 3. Okay, I'm going to remove the excess lotion and carefully return Miss Lucy to her back lying position. Alrighty, I'm going to get a clean gown. Unfortunately, I only have this one little shirt that fits Miss Lucy, and I'm going to replace her gown. Alright, I'm going to cover her with her sheet as I remove the bath blanket. Okay, I'm going to put this with my linen. All right, Miss Lucy, here is your call bell. I am going to be right back, and I'm going to take care of cleaning up the supplies. I take my linens. The linens would go into a hamper. We're going to pretend there's a hamper right here. I'm going to take my barrier, and because they're made of paper, this one is not, I would throw it into the garbage, but we're just going to put that with the towels. The basin will get dumped into the toilet. We would rinse it out. We would dump that into the toilet. We would dry it out with a paper towel, place it on a barrier, remove our gloves according to procedure. This gets thrown into the garbage can, and I go back into the room with the clean item. Miss Lucy, I'm going to put your items back into your bedside stand, and I'm going to get my resident nice and comfortable. Would you like your head up? She says yes, so she's up in her bed. All right, I'm going to make sure I have a little toe pleat in her sheet so she's nice and comfortable, has enough room. Fix her gown. All right, you have your call bell. Open up my privacy curtain. Your table is right next to you. Would you like your reading material or a remote control to watch television? She says no reading material, but she would like the remote on the table. Okay, I'll be back in about 15-20 minutes. Check on you. You have your call bell if you need me. At this time, I would think about my skill, make sure I didn't forget anything, make any corrections, and then I would say, I washed my hands, I provided a partial bed bath to my resident, Miss Lucy, and I noticed that she had some redness under her right breast. I would like to report that at this time, and I'm done. I'm ready to move to my next skill. And that's it. So I thank Miss Lucy for being my patient, and I hope you enjoyed your first skills lab in my daughter Victoria's bedroom. See you tomorrow.